And now, from Washington's leading news station, this is News 4 Midday.
Think nothing can be done about cellulite? A barrage of products and procedures promise to seek out and destroy that lumpy fat on thighs, bottoms, arms, and tummies. But is a miracle cellulite assassin out there somewhere? Well, we're joined today by Dr. Rodney Walker and her patient, Marjorie Sharan, with a look at a new treatment that has some promise. And your patient tells us it worked for her, so we want to hear all about it.
It works very well, and everybody's very pleased.
Well, tell me, first of all, what is cellulite?
Well, cellulite is a combination of fat and tissue that's being contracted down or pulled down. It's actually genetic, it's actually hormonal, and it can be seen in mainly females. Probably 80 to 90% of females have it somewhere on their body. It begins about being visible about the age of puberty or older, but actually in studies that they have done, female fetuses at the age of 4 months of age are shown to have cellulite where male fetuses do not.
Well, are we supposed to have it?
No one has shown any genetic reason why it would be advantageous, but we certainly do have it, and while only about 10% of men, it's definitely a female anatomical structure that causes us to have the cellulite.
Well, Marjorie, when did you first notice yours, and where was it, if you don't mind my asking?
That's fine. I basically had it on my upper thighs and on my buttocks, and I started noticing it, when I was in my late 20s. And it didn't matter how much I worked out or what I did or how I changed my diet. I tried several products, and it just didn't do anything.
There have been creams, and of course there are loofahs and all kinds of things that they say will take care of it. There's even one place on the internet where it says, push this button and we're going to give you the secret. But you have the secret now. Tell us, we know where it appears, but what can you do to get rid of it?
Well, the new system that's out, and really in my mind, this is the only treatment for cellulite, the only treatment that works. And I've been also through the creams and the loofahs and the endermology and everything else, is the new 3D Cellulaze YAG laser.
Is it shrinking it there? Is that what we're looking at?
What is happening now is initially you put this small laser in, and initially it melts the fat. What it's showing right here was the breaking of the septum of the fat structure. Maybe it's going to go again. And then the laser comes in again underneath the skin, heats up the skin, so it thickens the collagen, and it smooths out the area so you don't have the dimpling.
Wow.
As you can see on these pictures, here's before, and here is after, with a nice smooth skin on the lateral thigh of this patient. And,
well, there are a lot of women, a lot of us out there, and I guess not very many men who would really like to be able to look better in a bathing suit because that's there. Because even when you lose weight, it doesn't go away, does it?
No, it doesn't go away. Many thin women have it, and many women will notice it more as they get older. And that's why this is such a great new machine that is out to do it. It's made by Cynosure, and it's it's a 3D YAG laser. It's also part of the Smart Lipo is also in the same component and system as this.
Did it hurt, Marjorie?
No. I mean, I didn't feel a thing. Basically, you don't even have to go under general anesthesia. You go into the office, into a private office. It takes, what, about an hour, hour and a half?
And one treatment is enough?
One treatment is enough.
Let's have a look at your before and after pictures to see if you don't mind us sharing those with everybody. There, I can see the before. There, it's not that bad, Marjorie, but it certainly does look different.
You can see the lateral side.
Oh, yeah,
there we are.
I see.
See
That's
the difference right there.
Wow. So one treatment is enough, and it takes about 45 minutes.
About an hour. I mean, about an hour, because usually you're doing both thighs. So it's about an hour to an hour and a half, depending on the area that needs to be treated.
So you think this is finally the answer?
I think it's finally the answer.
Well, there are a lot of women who are going to be happy to hear that. I've been fighting mine for a long time.
Believe me, if I could hook myself up to the cannula, I would.
And it keeps getting better and better. I'm amazed. It's really a miracle.
So you mean what you get right at the beginning is not the way it's going to end up?
Because the collagen still has to develop and thicken and contract, so you really get maximum results at about 90 days out.
Is it pretty expensive?
It's comparable to liposuction, so it's on the average around $2,500 per site. And then, of course, if you're doing more sites, the fee goes down.
Is your whole bottom one site, or is that two sites?
It's two sites.
All right.
It actually depends on exactly how many squares we do, but in general, it's two sites.
All right. Well, some people will be saving up that for a holiday gift, I guess. Thanks so much.
Thank you.
We really appreciate your coming in, and we certainly appreciate your bearing all to show that it really works.
I think it's worth it for every woman to explore these options.
Well, I think it's something we're all interested in. Thanks so much, Dr. Rodney Walker.
Thank you, Barbara.
And thank you very much again for coming. And your patient, Marjorie Sharan.
Thank you.